Let's see what is our final case. A 30-year-old man presents to the OPD with complaints of weakness of arms and hands, painless burns over the fingers since 6 months. On examination, vitals were stable. Muscle wasting over arms was present and there was loss of temperature observed over the arms and hands, and reflexes were diminished. So what is the most probable diagnosis in this case? Add a note on investigations and treatment. What is importance of dissociated anesthesia? What are the other associated abnormalities with this condition? And what is Barber's chair sign? Well, in this case, what we are getting is a loss of pain and temperature sensation. That's why the person is getting painless burns. He is not even aware that something is damaging his fingers, and that is painless. Also, there is loss of temperature sensation. However, the tactile sensation, vibration sensation, all are intact. So, this is known as dissociated anesthesia and is present in the case of syringomyelia, which mostly affects the cervical region. So, in syringomyelia, what happens? A fluid-filled cyst forms in the region of the cervical spinal cord. The investigations needed are X-ray of cervical spine and MRI. And treatment is mainly surgical, where ventriculoperitoneal shunt is required to relieve the cyst. Then our next question was, what is the importance of dissociated anesthesia? Well, it signifies damage of grey matter around the central canal, and there is a sparing of a dorsal column pathway and tactile sensation is preserved. So, for that we need to know the anatomical basis of these pathways, where these pathways, dorsal column and anterolateral spinal thalamic tract, are travelling in the spinal cord. So, if there is damage around the central canal, the pathways which are near the central canal will be affected, and that is why in this anterolateral spinothalamic tract is affected and pain and temperature sensation is lost. However, dorsal column remains intact. Then what could be the other associated abnormalities with this? Well, it can be associated with thoracic scoliosis, that is the bending of the spine, lateral bending, Arnold Chiari malformation in which the brain tissue actually herniates into the spinal cord, Horner syndrome in which the sympathetic nerve supply to the eye is affected, and traumatic necrosis of cord. Then our last question was, what is Barber's chair sign? Well, sudden flexion of the neck causes shock-like sensation along neck to arms and feet, and this is positive in syringomyelia. In summary, in this video we discussed the cases of cerebellar disorder, basal ganglia disorder, sensory deficit, motor deficit, and that one affecting the visual pathway. Thank you.